Hi everyone, it's me, we're here again, and I'm coming to you today to have a chat about urinary tract infections, also known as UTIs. Right, so a UTI is an infection affecting the urinary tract, and the urinary tract is described as the part of the body, the drainage system of the body, which tries to get rid of urine and waste matter in form of urine and extra fluid. Now, just a bit of an introduction about the urinary tract. It's made up of two kidneys and a bladder, and also has two tubes which connects the two kidneys to the bladder, and also a small tube that connects the bladder to the outside. Right. Now, today I'm going to be talking more about urinary tract infection in women, because did you know that women are 14 times more likely to have a urinary tract infection than men? Now, this is because, well, for two reasons really. One of which will be a woman's urethra, which is the small tube that connects the bladder to the outside, is very short, and so the bugs, the germs, have a shorter route to travel from the outside into the bladder, hence the higher risk of having an infection. Now, the second reason is because the anatomy of a woman is such that the urethra, which is this tube I'm talking about, is very close to the anus, and most urinary tract infections are caused by germs and organisms coming from the anus and transferring upwards into the urinary tract. Now let's talk about the possible symptoms you would get if you were to have a UTI, one of which would be a burning or stinging sensation when you're passing your urine. You might also find that you're needing to go to the toilet more frequently to pass urine, and you might notice that your urine is a bit smelly or cloudy. You could also notice some blood in your urine, and usually would advise you to have a chat with someone if this happens. You could develop some fever, feel unwell and tired. And in the older population, the elderly mothers and grandmothers, you might find that a UTI can trigger acute confusion, and that's very non-specific and difficult to diagnose. Now, there are a few things that can increase your risk of having a UTI in addition to being just female. One of which would be pregnancy. We find that pregnant women are at a higher risk of having a UTI. We also find that people who have other conditions such as kidney stones, anything at all that will block free flow of urine from the kidneys down to the bladder and out, anything that obstructs this natural flow can cause a UTI, can trigger or increase your risk of having a UTI. Now, if you've maybe been hospitalized or have for some reason needed to have a urinary catheter, which is like a tube put into your bladder to help you pass urine, this can also trigger or increase your risk of having a urinary tract infection. Now, if you have other medical conditions which reduce your immune system, so for certain patients who have diabetes, or people who for some on chemotherapy, we find that because their immune system are weakened, their body isn't strong enough to fight off infections, and they find that they might be at a higher risk of developing developing a UTI. Now, if you did suspect, going by the symptoms I've listed above, if you did suspect that you were having a UTI, what next to do? What next do you do? Well, the first thing you need to do is probably have a chat with your doctor, and your doctor will probably ask for a urine test. So your doctor would most likely want to confirm a diagnosis of a UTI, and could ask for a urine sample, which they will send off to the lab and get tested. This is usually very straightforward and diagnoses a UTI more often than not. Your doctor, however, might want to do some other tests, such as a blood test, and also might want to rule out any other source or cause of infection. Now, let's say you've been diagnosed with a urinary tract infection, either going just by your symptoms or also confirmed with further investigations. The most likely treatment to be offered would be a course of antibiotics. Now, UTIs are usually very amenable to antibiotics. They usually you usually start feeling better about the fifth day of the antibiotics. So it is advised that even if you're feeling better, to always complete the course of antibiotics to reduce the risk of developing resistance to certain antibiotics. And from your end, you can always take some paracetamol, which would help with the pain and also with the fever. It's also encouraged to take loads of fluid to encourage free flowing of waste and fluid, and to wash out your bladder and your urinary tract. Now, there are other certain things that can increase the risk of having a UTI, such as constipation. And so it's advised that you ensure good bowel hygiene. Make sure you're emptying your bowels frequently, and you're not getting or you're not being constipated. So let's say that that's all treated. How do you prevent further infections? Well, you can't prevent a UTI completely, but there are certain things you can do to reduce your risk of having a UTI. Now, one of the commonest measures we ladies can take will be to ensure good hygiene when we're wiping down below. So we should always wipe from front to back to make sure we're going from the area of higher sterility to the area of less sterility. Because if you did wipe from back to front, what it would mean is you will be introducing the germs from your anal region up towards your urethra. That's where you pass your urine, and hence you're increasing your chances of introducing a bug into your bladder. Now, the other thing you can do is to always ensure adequate and plenty fluid intake. Always keep yourself hydrated. Always make sure you have enough fluid going through input and output. Now, the other thing that is actually very important is to ensure that you empty your bladder each time you go to the loo. So that means that each time you go to the toilet to pass urine, you shouldn't pass halfway and retain half of the urine. And also to ensure that you go to the toilet each time and promptly when you feel the need to go and pass urine. So each time you feel your bladder is full, you need to go and concentrated urine in the bladder is just ample ground for bacteria and organisms to grow and multiply. Now, the other thing that's encouraged is to wear loose underwears. Make sure you avoid very tight or nylon underpants or tight jeans trousers. Now, let's say that you've had a UTI and you've been given antibiotics and it's 5 days afterwards and you're still feeling unwell. What do you do? Well, at this point, I would recommend you have another chat with your doctor, especially if you're not getting any better, if you've not noticed any symptomatic relief following the antibiotics, if you're still having very high temperatures, or if you're having a pain in your sides, which would kind of point towards having a kidney infection, which is a more severe type of urinary tract infection. I would suggest urgent discussion with your doctor to ensure a hospital admission for stronger antibiotics, or if you needed any further investigation. Now, if you do also find that you're having recurring urinary tract infections, it is also encouraged that you have a chat with your doctor, because they could perform some investigations, make sure you don't have your immune system isn't weak, make sure there isn't any other thing that's putting you at risk of recurring infections. And also, if you were found to have recurring UTIs, you could be placed on antibiotics as a preventative measure, which means you might be taking low dose of antibiotics going forward to help prevent you having these infections going forward. Right. If you have any questions regarding this topic, or if you have any recommendations for any further topic you want me to discuss, please leave a comment down below and I'll try to address them. In the meantime, can you like this video and share it with your friends, and also subscribe to my channel. Until next time, see you guys later. Bye.